Hello, this is Dr. Rockson Liu, dedicated hernia surgeon in Emeryville, California. I'm going to skip around. I know I was on the topic of ventral hernias last, but I'm going to talk about mesh removal because I get a lot of patients that come to me wanting mesh removal. And it's an interesting topic because there's just not a lot of literature to support what should be done. People come for all different reasons for mesh removal, but I would say the main one is pain. They have a hernia surgery, and after hernia surgery, they start having pain. And of course, after hernia surgery or after any surgery, you're going to have pain, the surgical pain. But that pain should not last more than a month to 3 months, and after that, the pain should go away. And so especially after ventral hernia repairs, I have some patients who come back wanting mesh removal. Now, the need for mesh removal should be extremely, extremely rare. This is, about million inguinal hernia surgeries get done a year, or more than that in the United States. 700,000 ventral hernias get done, but the need for mesh removal should be pretty low. Okay, but I'm convinced that some patients do benefit from having mesh removal. Now, what can cause what we call chronic pain? Pain that lasts 3 months after hernia surgery. There's multiple reasons, and I'm not going to list all of them. But the number one thing I always ask patients is, did you have this pain before surgery? And I have patients that will come in all the time and say, Doc, I still have this pain after hernia surgery, and I think it's from the mesh because I feel the mesh. Well, my first question is the pain you're having the same as the pain you had before surgery? And if the pain is the same, then maybe your hernia wasn't causing the pain, and you still have the same pain that you had before surgery, and whatever caused the pain is still present because maybe it wasn't the hernia. And just because you had a hernia doesn't mean the pain was from the hernia, right? So don't confuse the two. If the pain that you have after surgery is the same as the pain you had before surgery, then it has nothing to do with the mesh. Do not have mesh removal, okay? For inguinal hernias, maybe a nerve was trapped or damaged, right? And so neuropathic pain or pain from the nerve is very different from mesh pain. Neuropathic pain is burning, stinging, lancing, cutting, all the sensations you would expect from a nerve that's being damaged. And a good hernia surgeon can figure out whether it's nerve pain or mesh pain. And if you have nerve pain, then mesh removal is not the reason. It's not going to fix your pain. Sometime you can have things like hematomas, seromas, fluid collections in there that's pressing on stuff. And so an ultrasound or CT scan can usually identify it. Sometimes some patients just take longer to heal for some reason, and it takes longer than 3 months for their pain to go away. Or maybe they did certain activities and caused a lot of inflammation, and now they're set back, and the timeline has now been kind of rewound, and they're starting over again. And so there are some patients who still have the inflammatory postoperative pain from the surgery that's lasting more than 3 months. So I always have patients wait about a year before even considering mesh removal. So let's say the patient doesn't have the same pain that they had before surgery. They had, let's say, zero pain before surgery, and they have now chronic pain from the hernia surgery. It's not a nerve pain, and it's not post-operative inflammatory pain. Then the history becomes really important. I usually dive very deeply into the very specifics of when the pain started. Did it get better? Did it not get better? Is it the same? Does anything exacerbate it? Does anything make it better? And really try to have them describe the character of the pain, the location of the pain. Does it radiate? Does it involve other parts of the body? And usually the first, even if it sounds like it's mesh, I don't take out the mesh. We try ibuprofen, we try other medications. I'll have patients see a pain specialist, maybe a physical therapist to do stretching, because sometimes those ancillary treatments do help and can either relieve the pain or diminish the pain such that the pain is now livable, okay? Because mesh removal is a very difficult operation, and potentially it can lead to complications, okay? Mesh, even though this mesh that I'm using, it looks very benign, right? This mesh, right? Should be easy to remove. If you have watched any of my YouTube videos where I show mesh removal, I use those videos to teach surgeons, but you can certainly watch them. The mesh is really, really scarred in. I mean, a lot of times it's almost like somebody poured concrete or super glue around the mesh, and I got chiseled out of the body. And as you can imagine, the meshes are, especially in the groin, they're stuck to a lot of important structures. The testicular vessels, the vas deferens, so you can certainly lose those structures in the process of taking out mesh. The iliac vein and artery, the blood vessels going in and out of your legs, right? The bladder, the inferior gastric vessel, which is not as big a deal if we take it, but it's still a big vessel. So those things can be injured. And then there's the nerves, the genitofemoral nerve, the lateral femorocutaneous, even the obturator nerve can be involved. Those can all be injured, and you can end up with even more pain. For ventral hernia, the main concern is that once you remove the mesh, you got a hernia again. Now, how do you fix it? For the inguinal space is kind of the same. And then for ventral meshes, if it was an IPOM, remember that this mesh, if there's a lot of intestines stuck to it, separating the intestines can lead to injury of the intestine, a hole in the intestine. And now that's a different ballgame, because now you can have an anastomotic leak. So mesh removal is a very difficult operation. And so it's not something you want to jump into lightly, because you can have more pain after surgery, more chronic pain after surgery, and things can be damaged such that you could be disabled from important structures being damaged. Now, having said that, the robot has given me the ability to do some pretty incredible things when it comes to mesh removal. I would say probably just even 5 years ago, mesh removal wasn't really risk worth taking, except for in the most extreme situations. But the robot, the precision of the robot, my ability to magnify things, my ability to stay hemostatic, has allowed me to essentially chisel the mesh off of very important structures and find the very subtle plane between the mesh and the important structures, such that it is now safer to remove mesh. It's still a dangerous operation, but definitely safer in my hands now with the robot. Now, having done thousands of robotic surgery, it's become much safer. So it is an option. Now, do patients get better after mesh removal? I think if the indications are there, then mesh removal can help. Now, some patients have had pain for a long time, such that their body, now the neuroplasticity has essentially ingrained the pain pathways in those patients, and they're going to have pain whether the mesh is gone or not. But most of these patients do find some relief with a mesh removal. The mesh that has been there not as long, maybe they're going to have more relief. I haven't had patients where their pain got worse, which is my biggest fear, is that where I'm taking a patient who already has a lot of pain and making it worse. But I think being selective, talking to the patient, understanding the patient, and really understanding the type of pain they're having leads to choosing the right patients for mesh removal, and then just being very careful in the operating room, using the robot to remove the mesh really can help the patient. Of course, if the mesh was placed as an onlay, open through under the fat, or in the groin as a Liechtenstein, then robotic surgery is not going to be usable. Then we do it open, and there's different trade-offs with that too. So that's kind of the quick and dirty on mesh removal. I think I'll spend some time in the future to really dive into some videos and show you how difficult it can be, what structures are there, and show you more. Okay? Thank you for watching.